Headlines. Amphan aftermath. Kolkata continues to struggle without power and water supply. What is behind the latest India-China border flare-up? Why are India and Nepal fighting over Kalapani? Health Ministry releases guidelines for international arrivals and domestic travels. Yogi Adityanath government revokes ban mobile phone in COVID-19 hospital. Tirupati Temple Trust to auction 50 immovable properties in Andhra Pradesh and Tamil Nadu. 5 columns of the army have been deployed in parts of Kolkata on Sunday following a request by the West Bengal government to restore normalcy after the devastation caused by Cyclone Amphan. Each column, having 35 personnel and divided into small teams, started working from Saturday night. At present, army personnel are located in Ballygunge, Southern Avenue near Salt Lake, Purnashree, Bihar according to a communication from the Eastern Command. They are mainly engaged in cutting the trees and clearing the roads so that electricity can be restored, which remains the key problem in the city and South Bengal districts over the last 72 hours. The India-China border has been witnessing tensions over the past month, with incidents reported in at least 4 different locations along the line of actual control, LAC. On May 14, Indian Army Chief General Manoj Naravane said incidents at the Pangong Lake in Ladakh on May 5 and at Nakul and Sikkim on May 9 had led to injuries, caused by aggressive behavior on both sides. He said the 2 sides had disengaged. Standoffs at 2 other spots in Ladakh, in the Galwan Valley and in Demchok, have reportedly escalated with a build-up of troops by both sides. On May 22, General Naravane visited the LE-based 14 Corps headquarters in Ladakh to assess the situation. The dispute over Kalapani, which lies on the easternmost corner of Uttarakhand's Pithoragarh district, between Nepal and India was revived in November 2019 when India published a revised political map showing the newly created union territories of Jammu and Kashmir and Ladakh. Both India and Nepal lay claim to Kalapani. The map showed Kalapani as part of Pithoragarh district. Nepal protested immediately and drew attention to the lingering issue. On May 8, India inaugurated the Darkhila-Lipulek Pass Link Road, cutting across the disputed Kalapani area, which is used by Indian pilgrims to Kailash Mansarovar. Nepal hit back by summoning the Indian ambassador to Nepal, Vinay Mohan Quatra, to convey a formal protest. All international passengers arriving in India will have to give an undertaking before boarding that they would undergo a mandatory quarantine for 14 days, 7 days paid institutional quarantine at their own cost, followed by 7 days isolation at home with self-monitoring of health, according to the Health Ministry guidelines released on Sunday. However, in exceptional cases and for compelling reasons such as human distress, pregnancy, death in the family, serious illness and parents accompanied by children below 10 years, as assessed by the receiving states, home quarantine may be permitted for 14 days where use of Arogya Setu app would be mandatory. The ministry has added that only asymptomatic travellers will be allowed to board or come through land borders. Those found to be symptomatic during screening, on return, shall be immediately isolated and taken to medical facility as per health protocol, added the guideline. The ministry has also released guidelines for domestic travel, air/train/interstate bus travel, stating that do's and don'ts shall be provided along with tickets to the travellers by the agencies concerned. Also states, union territories have been asked to develop their own protocol with regards to quarantine and isolation as per their assessment in consultation with the central government guidelines. The Yogi Adityanath government has modified its decision to ban mobile phones in COVID hospitals. In a circular issued on Sunday afternoon, the state government has now allowed patients to carry their phones in isolation wards after making the disclosure to the officials concerned. The mobile phone and the charger will be thoroughly disinfected before the patient enters the ward. The patient will not be allowed to share the mobile phone with any other patient. At the time of being discharged, the mobile phone and charger will again be disinfected by the health workers. Tirumala Tirupati Devasthanams, TTD, has decided to auction 50 immovable petty properties located at different places in Tamil Nadu, Andhra Pradesh and Rishikesh in Uttarakhand, a top functionary of TTD said on Sunday. The immovable properties which are set to be auctioned include tiny houses and house plots measuring between 1 cent and 5 cents and farming lands between 10 cents and below 1 acre, said Subba Reddy, chairman of TTD board, which governs the famous hill shrine of Lord Venkateswara at Tirumala. A total income of about Rs 24 crore is expected to fetched from the auctions, Reddy said. COVID-19 updates in India today.
Thanks for watching. Like, share, comment. Subscribe to Inverse Dark and activate bell icon.